Imagine a bustling coffee shop. The aroma of freshly brewed coffee fills the air. Suddenly, a young woman at a table drops her cup, her body stiffens, and she falls to the floor. Her eyes roll back as her limbs jerk uncontrollably. People gasp, unsure of what's happening. This, unfortunately, is a glimpse into the world of epilepsy. Epilepsy is a neurological disorder that affects the brain, leading to recurrent seizures. Seizures are sudden bursts of electrical activity in the brain that disrupt normal brain function. These episodes can manifest in various ways, from subtle staring spells to dramatic convulsions. The woman in the coffee shop is just one of millions around the world living with epilepsy. This condition doesn't discriminate. It can affect anyone, regardless of age, gender, or ethnicity. Epilepsy often carries a stigma, fueled by misconceptions and lack of awareness. This essay aims to shed light on the truth about epilepsy, dispel common myths, and foster a better understanding of this often misunderstood condition. Epilepsy is more common than many people realize. It affects over 50 million people worldwide, making it one of the most prevalent neurological disorders globally. In the United States alone, an estimated 3.4 million people have epilepsy. The World Health Organization recognizes epilepsy as a public health priority, particularly in low and middle-income countries where access to diagnosis and treatment is limited. The impact of epilepsy extends beyond the individual, affecting families, communities, and healthcare systems. The economic burden of epilepsy is substantial, including healthcare costs, lost productivity, and premature mortality. However, the true cost of epilepsy goes beyond monetary value. The social stigma, discrimination, and reduced quality of life experienced by people with epilepsy are immeasurable. It is crucial to debunk the myths surrounding epilepsy and promote accurate information. Increased awareness is essential to improve diagnosis, treatment, and support for those living with this condition. The underlying causes of epilepsy are complex and varied. In many cases, the exact cause of epilepsy remains unknown, referred to as idiopathic epilepsy. However, several factors are known to contribute to the development of this neurological disorder. Genetics plays a significant role in some types of epilepsy. Certain genetic mutations can increase an individual's susceptibility to seizures. For instance, mutations in genes responsible for ion channels, which regulate electrical activity in the brain, have been linked to various forms of epilepsy. Brain injuries, such as those resulting from trauma, stroke, or brain tumors, can also lead to epilepsy. These injuries can disrupt the normal electrical activity in the brain, triggering seizures. Infections like meningitis and encephalitis can cause inflammation in the brain, increasing the risk of developing epilepsy. Developmental abnormalities such as cortical dysplasia, where the brain's outer layer doesn't develop properly, can also contribute to epilepsy. Other factors, including prenatal injuries, prolonged high fever during childhood, and certain metabolic disorders, have been associated with an increased risk of epilepsy. Section 4. Decoding seizures, types and characteristics. Seizures, the hallmark of epilepsy, are not all the same. They vary based on the brain area affected. Understanding seizure types is crucial for diagnosis and treatment. Generalized seizures affect both brain sides, causing loss of consciousness. Tonic-clonic seizures involve body stiffening and jerking. Absent seizures cause brief staring episodes. Focal seizures start in a specific brain area. Symptoms depend on the affected region. Simple focal seizures cause twitching or sensations. Complex focal seizures alter consciousness and behavior. Some focal seizures evolve into generalized seizures. This spread is called secondary generalization. Accurate classification guides treatment. Anti-seizure medications depend on seizure type and severity. Section 5. Recognizing the signs beyond the seizure. Recognizing epilepsy signs goes beyond identifying a seizure. Many experience subtle warning signs called auras. Auras vary by individual and seizure type. Common auras include stomach sensations, chest rising, unusual smells or tastes, visual disturbances, dizziness, and detachment from reality. Recognizing auras helps prepare for seizures. Other symptoms include memory issues, mood swings, and sleep problems. These impact quality of life. Not all seizures mean epilepsy. Fainting, heart issues, and panic attacks can mimic seizures. A thorough medical evaluation is crucial for accurate diagnosis.